Power Zone with Katlego Legodi, 12 to 3 a.m.
So we close the show off this morning with Dr. Jane Simuga, who's coming through as a medical practitioner and founder of Ask Dr. Jane, just helping us to continue really with this theme of medical health care. Here, just talking about the issues of those that would be unsung heroes. You had me give, a good doctor there her flowers, and just Dr. Maimele for being frank about some of the day-to-day challenges that they experience. And that is where I'm going to start with Dr. Jane as well this morning to just get a sense of how then, she finds herself in this space and why she keeps going back because you hear that these challenges are many, and then you understand how I'm trying to build this one because I'm trying to show you the importance as well of this particular profession. You had Dr. Maimele just talking about how we wouldn't want to see the doctors, the nurses leaving South Africa to go practice elsewhere when there have been greater investments and even the practicals here. You hear and you see a lot of people from outside, even of South Africa, coming into South Africa to train this side because of the best healthcare space and education, the best healthcare education that we have here at home. You'll find us live on 0861 987 000, and there on X we go by at PowerFM 987 at Katlego Legodi _ Dr. Jane Simuga, good morning. Welcome to the show.
Hi, good morning, Katlego. Good morning. Thank you so much for the welcome. So happy to be with you guys this morning. Good morning to our listeners as well.
Thank you very much for giving us your time here. And I'm not sure if you were listening to the conversation that we had earlier on with Dr. just before we took you on, Dr. Maimele. We were talking about and reflecting on the medical space and just this morning getting a sense of how then things have moved, if not moved, 31 years into democracy, where lies the opportunities, but at the same time, what interventions we'll need to do to ensure that we safeguard this space and those that work within this space. You are a doctor, Dr. Jane. Maybe give us a sense of why you went into this space to practice, to study, and why you keep going back to it, looking at the fact that there are those challenges that are stuck.
Oh, that is such a good question, Katlego, and it actually really speaks to my heart as a medical practitioner. When I went into medicine, it was with a heart to help people. You are not usually ready for the challenges that come, though, with offering yourself into a noble profession. You begin to realize that almost every day is somebody's life or living or livelihood on the line. That is actually why we do what we do, because we love to make the difference for people who, if we were not in that gap for, they would have absolutely nobody else who could help them. So when I studied medicine, it was to be somewhere where I could help people. And this is also a big reason for why I do what I do at the moment. I have a heart for reaching vulnerable people, for reaching people who are not touched and are not reached by our healthcare services in a normal place and situation. I have a colleague who, during his community service, we were sharing experiences, and everybody certainly has something to complain about. He was telling me a story in a very understaffed hospital in a very rural area of our country where some people were involved in an accident in the middle of the night on the road. And he works in the kind of place where he's the only person who's on call in the middle of the night. So these people they picked themselves up, the pieces and everything, put themselves into a van, and they ran. They ran driving to his hospital, screeched to a halt at the front, and there they were. And he basically had nothing to help them with. He tells me many times that sometimes ambulances can't even get to where they need to get to pick up patients. So half of the journey is quite literally on a donkey, and then they walk the other half, and then eventually maybe hike the rest of the way. That sounds so unrealistic. But for him, the reason he did not leave practicing medicine is because he was there to make a difference. The reason we continue to be here where we are is because we plan to make a difference. We don't want to take these excellent services, this excellent training that we've had. By the way, South African doctors are absolutely world class. So at the drop of a hat, they have opened doors for us in countries all across the world. But we are here to serve the people on home ground. We are here to make lives better for people on home ground, to make sure that everybody has a doctor who they can reach, who they can call, to get medical advice, to get some help, to get a treatment plan. That's why we haven't left.
Oh, I love what you said there about making a difference, really, because you literally do make a difference. When you mend that broken arm and we are able to move and write again in a couple of months because we got interventions, that is something that helps. Immediately when I have a headache and then you say to me, do this and do that, and then I'm productive again, that is just something of what making a difference would mean. At times you look at it and you think that is the big, operations where we have to cut and do all of these things. But just that little help, helping someone deal with that migraine, it does then go a long way in helping them have clarity, at the same time mobility. I just am a fan of who do we call them? The ones that help you to move. What do you call them? The physiotherapists. I'm a fan of physiotherapists because I'm one person that would want to see the practical ways of really doing it, from you not being able to stand to just taking that one step and being able to run again. And that is something that I would look at and say, these people are heroes, really, when you look at it, looking at the complex situations that you find yourselves in. The theater room is one of those rooms that are so scary, but we still see you going in there day in and day out, which is why we do say that you are heroes here. But I want us to talk about some of these professions that sometimes we don't give flowers for, and you look at them and then you feel like they're far off, but there's a greater impact. You do have those trauma surgeons that deal with a lot. I mean, when there's trauma, all of us would want to step back and shy away from even looking at one person, that blunt and the likes. But we do have trauma surgeons that move into these space, and they perform this critical care. They ensure that at the same time they move into these spaces on an emergency kind of a base, because this person is between life and death.
Such a good question. Hey, our unsung heroes in healthcare, these hidden heroes of ours. Actually, the big one is actually, I believe, emergency health and auxiliary health that you mentioned, the physios, the OTs. So, for example, after an accident, for example, you would have deployed emergency services there. They're not just people who are given a license to move traffic and skip red lights. They are highly, highly trained individuals who can manage critical conditions in the most awkward situations. They can do things upside down, hanging from parachutes with one leg here and one foot there. And they are just so critical as the first point of care for when there's an emergency, to make sure that someone arrives safely at the hospital. And then when you get there, this is even before the doctor, before the surgeons have laid a hand on you, have laid a finger on you, there's admin staff involved. So these are people who make sure you have an identity in the hospital, that you have a name and a surname, and they say this is somebody's brother, mother, father, so that when the doctor has to make that phone call to say, your person just came out of theater, we know who we are talking about and who we are talking to. These people were so critical for us during COVID, for example. We had such high patient burdens. For me, my patient would say be Katlego Legodi, but is it Katlego from east or is it Katlego from west? And they would really help us with patient identification. Even our nurses, who do such a thankless job absolutely thankless job. They have the worst reputation in this country, and they are actually the real backbone and our eyes and ears in the hospital. They make sure patients have eaten. They bathe patients. They turn them over if they cannot move on their own. They make sure they take their medication. 9 out of 10 times, it's the nurse who will say to me, "Doctor, you prescribed XYZ medication for this patient. The patient cannot swallow. Do you think we could maybe do 1, 2, 3?" I say, "Yes, of course." They don't just give medication. They make sure that it's safe for the patient to take. Is the pain medication working? Doctor, the patient is still in pain. Doctor, the patient cannot sleep. And they are the ones who get the bad rep, like, "Oh, these nurses do nothing." The OTs, the physios, radiographers, after this, they stay awake all hours doing x-rays for you. It's like the doctors, we are part of a team. We are part of a team, and we cannot do this on our own. Then eventually, after all that, you get to your surgeon.
Yeah, I think surgeons as well. I mean, when you look at the fact that they would be the ones that will have to bring you back to life, literally. I know of the foundation that has been built by all of these role players, but that machine is where then you find them, and then you get a sense that they have to really perform this in a space of ensuring that they safeguard these lives. And the conversation that we had with Dr. Maimele, you hear him just talking about how most of these people are looking at the face of death every day. They are looking at the face of death. You're staring at death in the face, but you really come back and you do this diligently and approach it with grace. Another one, if I can add on there, Dr. Semuga, that we don't usually talk about would be the ENT, right? That becomes important in terms of the ears, the nose, and really just ensuring that you come through for those, the ears, the nose, and the throat, the ENT. How important is that? Because one would look at it and say that for everyday living, your ears, you'd think, no, I need to hear. And the nose, I need to breathe, I need to smell. At the same time, throat, we tend to downplay this one, but it does speak to our day to day.
Absolutely true. ENTs are highly specialized surgeons, actually. They do what we call microsurgery because the area that they work in is so small. For example, Professor Mashudi Chifularo performed the first, this is worldwide, the first middle ear transplant using 3D printed ear bones. This is our very own local homegrown South African ENT who is restoring hearing across the globe. So it's not just a surgery about tonsillectomies and making sure people have straight noses after they've gotten a punch in the face. He does restorative surgery, cosmetic surgery, so growing ears for people who might not have ears when they are born. That's also something that plastic surgery does. They're not just cosmetic. They actually are in the business of making people look human, making them look like people, making sure they function like people. ENTs are also very involved in balance because your ear is very critical for your balance. So helping people live a life with normal hearing, normal balance. Something that a lot of people experience as well is chronic sinusitis. They always have this blocked nose or this runny nose. Go and see an ENT. They can help sort that out for you. They can fix that for you. Or people who get, for example, the tonsils all the time, chronically inflamed tonsils. And ENTs also partner quite closely with ophthalmologists. So ophthalmologists are specialized eye doctors. They're different from optometrists. Optometrists give corrective lenses and visual aids. An ophthalmologist is somebody who can operate on your eye to restore vision. So let's say after an accident or something and somebody has a laceration on their eye, these people have microscopes and major lenses that they use with stitches so small you can't even see them with the naked eye. That is somebody critical for vision restoration. And they do it every day like it's nothing. Just fixing people's cataracts, fixing people's eyes. They're amazing.
I often get confused, doctor, between an ophthalmologist and a pediatric, to say that how do we then differentiate between the two? No, not a pediatric, but an optometrist. How do we then
Hmm.
differentiate between the two, looking at the roles that they tend to perform on a human being?
So an optometrist is usually more easily available. You can find them in malls, in shopping centers, and they give corrective lenses, visual aids, and anything they can do to make your vision better. But they cannot perform surgery and they
Surgery.
cannot treat eye conditions. So an ophthalmologist will be the person that you would see if, for example, there's a pen stuck in your eye. You do not go to the optometrist for that. You go straight to the ophthalmologist so that they can stitch together, put your eye in the right place, make sure your eye still moves normally after that. Or if you have a baby, for example, who's born with what we call, the medical term is strabismus, it means like a cross eye. So sometimes people like that end up with double vision or blurry vision. These are things we take for granted because most people don't struggle with them. But it's somebody who would look at you and see two of you standing in front of them because their eyes are not aligned. So the ophthalmologist would do alignment surgery. They would do cataract surgery. Or if someone wants to stop wearing glasses, so the optometrist would give you the glasses, but the ophthalmologist would do the laser surgery, so you don't need to wear glasses anymore.
Yeah,
So an
no.
ophthalmologist is a doctor.
Yeah, who specializes, I guess, who goes deeper into all of these
Yes.
issues. Yeah, I like that breakdown because I often get confused. And you're right to say that you would indeed find these optometrists everywhere in the malls, and it's easy to access them. And yeah, that is something else. We're out of time, Dr. Jane, but I wanted us to really wrap it up with you, just encouraging a crop of those doctors that are still coming. Maybe there's someone that is listening to us right now and they are budding, they are burning the midnight oil while listening to the show while starting, to really become a professional in this space. At the same time, we do have some of your colleagues that are going through the most. Maybe I'll give you an opportunity to speak to them as well in terms of reminding them of the importance of this profession.
Medicine is one patient at a time and one day at a time. You cannot fix the world entirely, but you can fix it one patient at a time, one step at a time. If you are in the place where you're still studying, the same principle applies. One book at a time and one exam at a time, you will get there. So put in the time, put in the effort, be patient. Be patient and rest assured that this country trains the best doctors in the world. So for our patients and for our fellow colleagues out there, give yourself a pat on the back and just be aware that you are world class, world standard. And for our patients who come to see our doctors, look at your doctor, look at your auxiliary health staff and say, these are world class people who are treating me today. And let's just be grateful for them.
Let's just also be grateful for the gift of life, Dr. Simuga, because of all of these issues that tend to play themselves out. Really, really appreciate you coming through, starting the morning with us in this manner, for your wisdom, your expertise as well in helping us understand some of these issues. We're giving you your flowers as well this morning, Dr. Simuga, as the show. And we really, really say that you are one of our heroes and continue just, doing the good job that you guys are doing. We appreciate you. Sometimes we get there at the hospitals frustrated because of our own issues, but please be rest assured you do matter to us, and we appreciate the work that you do day in and day out. How do we direct people your way, Dr. Jane, for those that were listening to us and that like to follow your work?
I am available at askdrjane.com. You can search it up on Google. There will be a WhatsApp line where we can chat and deal with all the issues if any of the listeners have any questions that they would like me to address. So it's askdrjane.com.
Dr. Jane Semuga, really appreciate you coming through. Semuga, coming through. I always get that wrong. Please give me grace. But Dr. Jane Semuga, appreciate you starting the day with us.
Thank you so much. You guys have a wonderful morning further.